what kind of options are there for veterans who are looking to get eyeglasses?
When you talk about eyeglasses, people typically talk about regular glasses or reading glasses, which we call single vision glasses. Or you talk about bifocals, or you talk about progressive lenses, which are multifocal lenses. The VA, every VA has every one of those lenses. And when I see a patient and they have a certain type of prescription, then I'll recommend a certain type of lens. I'll never really recommend one brand versus the other. I think one of the benefits of the VA is we're very brand agnostic. And if we think this lens provides a benefit to the veteran, then we'll just prescribe that lens. We don't have to worry about how much it costs or if we're loyal to this brand or not at this practice. We prescribe what we think is best for the patient. If a patient comes in and having trouble reading, getting the small print, but they don't have a regular prescription, they only have a problem reading, then I'll probably just prescribe them a pair of reading glasses. Makes sense, right? If a patient has a problem, if they're nearsighted and they can't see far and they need glasses all day, and they also have a problem reading the fine print, then I'll prescribe bifocals. And then the question is, do I prescribe the traditional bifocal or do I prescribe the multifocal or the progressive lens? The difference is the number of focal lengths. And again, we go back to that camera analogy, right? And the traditional bifocal is focused at optical infinity. And then it's also focused at 16 inches. And so the top part of your glasses is your distance prescription. And the bottom part is this fixed focal length right at 16 inches. And then you ask me, why is it 16 inches? And that's because someone made the clever observation that people typically read at 16 inches. It's what the distance typically from your elbows to the tip of your fingers is where you hold that reading material. Of course, everybody's a little bit different. I have maybe a little bit longer arms, and so I want my focal length a little bit farther versus someone with shorter arms versus someone who's really close to the computer screen, which is bad for your eyes. And so I'll ask the patient if they've ever had either, if they've had a bifocal, if they would like to try a progressive, or if they've tried a progressive and they hate it and they just want to go to a regular bifocal. One of the nice things, I've worked in private practice also, and I enjoyed it, but one of the things that I enjoy about being at the VA is I don't have to worry about upselling anyone, right? Like if I don't necessarily think that they would like a progressive or a multifocal lens, I'll say just get a bifocal. I don't have to worry about the practice profiting a little bit more if I upsell the patient into a progressive. That being said, if I do think the patient would benefit from a progressive or a multifocal lens, I'll prescribe it. I'll tell them, do it, go for it. The VA covers that just as much as they cover a pair of reading glasses too. And it's no skin off your nose, and it's no extra cost to you to get that progressive, that no-line bifocal, that multifocal bifocal, as opposed to a pair of reading glasses. It's all covered in your benefits. And so if you think and the doctor thinks that that's appropriate for you, then go for it.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.